Okay, we're on to step number 2, which used to be my step number 1. So based upon my neurology background, way back in 95 through 97, through Dr. Carrick, I really learned a lot about neurology in the body. And this is really one of the things that I think separated me from most doctors, is that I always went to the nerve or the nerve root before I went to the area of involvement. So with Sam, we're going to be working today because he fractured this hip. He had to have major surgery. We're going to show you that scar here in a little bit. It's about 17, 18 inches. So it's pretty dramatic. So a nerve root is like bringing the communication from the trauma from what we call on a cell phone, for instance, a half a bar or 1 bar up to 4 bars. The higher the state of the nerve, the faster the healing part. So when I'm talking about nerve roots, in the past, most of the time I'd be doing it from the posterior aspect. So anything from the neck, I'd be doing C1, 2, 3, 4, into the shoulder, 5, C6, C7, we'd be coming down. But because of lasers have gotten more powerful and more dynamic, I like to come more usually anterior now, just because it's easier for me and the patient. Not that I don't come posterior, but this is where I'm going to go primarily. So great spots to start would be from the posterior aspect along the spine, and then anterior for the neck. And for most things coming into the neck and the shoulder, I'm going to come right here, right in the upper neck between the scalenes and the SCM, and then I'm going to come just below the belly button to the right here for the lower extremities. This is a 40-second protocol with 20 seconds of infrared and 20 seconds of red. So it only takes about 40 seconds to bring this to a higher state. What should I expect to find when I do this? I expect increased range of motion, and I expect increased muscle strength. That's how we were able to get FDA approval from doing our clinical trials. It was based upon not so much pain, but through range of motion and muscle strength, which are objective. Pain is very subjective. I want his pain to be better, but I really know when it's getting better when I see increased range of motion and muscle strength. So let me show you, coming from the posterior part, a couple of the places that we go. We're going to start on infrared, and we're going to just laser right here for the upper extremities. Okay, this is right on the neck here that you can see. I got the SCM. I'm going to pull it back a little bit for you. You're going to see it more if I switched it over to red. That's an easier one for you to see. So 20 seconds infrared, 20 seconds red. Now, his injury is his right hip. Okay, so we're going to come to that particular area, and we're going to switch it back to infrared, and we're going to come up right here. Now, I like to be on skin if at all possible. He's wearing something light cotton, it's white, not adverse to going through that, but if you can, you want to be directly on skin. He's wearing the glasses just for any scattered, anything that scatters. We don't want anything to happen in relationship to that. Because I'm on the skin, I'm not too worried about it. And just in order to do these videos and to help you understand and appreciate the laser protocols. So number 1, we started 2 inches or 2 fingers below the belly button. That's my step 1. Step 2 is resetting the nerve. So we have 20 seconds of infrared and 20 seconds of red. If you didn't have the combination, you could use one or the other. So if you only had a red beam, that would be fine. You could use that for entire 40 seconds. Or if you only had the infrared, you could do that as well. The beautiful part about having the red and the infrared is that I get different biological effects using both of them, which is really beautiful. So now I brought the nerve from a higher state, from the injury, to what we call a half bar up to 4 bars. All right, so that's step number 2.